The Predoctoral Internship program at Brown is an APA accredited internship. It's been an internship since 1975. It includes 4 different tracks. Those are adult, behavioral medicine, neuropsychology, and child. The child track includes both child clinical and pediatric.
We cover 8 different hospitals. We have geriatrics, we have kids, we have addiction, we have women's issues, we have anxiety, we have depression. I mean, it's just, there's so many people doing so many different things that I guess you can find almost anything you want here.
The internship year is, and really should be, an intensive clinical experience because it's the last year typically where people are really intensifying the clinical training and getting the depth of skills to move them towards being competent, independent clinicians. I think one of the things that sets us apart is that we really attempt to integrate some research training into that year. All of our trainees come and are matched to a research mentor, and we have protected time for research on a weekly basis.
So that was like key, and it was also 4 hours of research experience that you were guaranteed, that you set time aside for, and really provided you with like I felt like almost like a full-blown investigator, like really joining this research team that was doing like these really cool things that I just had read about.
That protected time is really well respected by all the faculty in the system. And people find that it tends to be a really nice feature that prepares them well for postdoctoral fellowship or ultimately a faculty position.
Mine was like a great fit for the research experience. It was really just a continuation of the line of research that I was doing in graduate school, but tackling it from like a different angle, and giving me the opportunity to do something here from a research perspective that I would have never had the opportunity to do in graduate school.
The Brown Clinical Psychology Training Consortium has a really strong commitment to having a culture of diversity here amongst our trainees and faculty.
Coming here, you could do like a bunch of different supervisions, a bunch of different placements with different people. I really felt that you could really like tailor the training to what you were looking for. So I really was impressed with like the diversity of clinical experiences that you could have.
I think it's an incredibly supportive environment for launching people into their careers, whether those careers are doing applied clinical work with specific populations, or if those careers are becoming a grant-funded researcher. There's a lot of thought put into how to help trainees get to where they need to go for when they leave.